Hi, I'm Claire from Cluesy. Thank you so much for tuning into my frequency today. So I just wanted to quickly touch base around endometriosis. Now, for you blokes, I know this doesn't relate to you. However, you might have a daughter or a wife or a girlfriend or somebody's brother's, sister's, cousin's, wife's niece that has endometriosis. So it might be worth listening to, sorry. So, most of you are aware, endometriosis is it's like a web that comes and it's basically the inner lining of the uterus, but outside of the uterus. And what it does, it just causes things to stick to other things. So sometimes people can get endometriosis and it involves their bladder, because if the bladder gets stuck or the bowel gets stuck. There's even been some, reported cases of there being endometrium in other parts of the body, nowhere near the uterus. So it's quite an interesting phenomenon. Now, in the clinic, you'd be surprised that I have had a lot of clients with endometriosis, and 90% of them, I will say, had a thing in common. They all at some point in their life either got glandular fever or had some horrific virus that modern medicine couldn't figure out what it was, and they were, sick for 5 months and stuff like that. And then, later on in life, they discover they've got this endometriosis. It's generally worse when it's that time of month, as things down there get a little bit inflamed anyway. So what is current medicine's solution to the problem? Surgery, which in itself causes scar tissue, which then in turn causes things they called adhesions, other things to stick to each other again. So it's not always the best option. Another option is people just go, oh, well, we'll just have a hysterectomy. Doesn't really solve it either. So when I say that all my clients have had a virus or something similar or a liver disorder, there's a big correlation between liver health and reproductive health. So, liver is responsible for 2,000 different things. I always talk about the liver. I bang on about it all the time. So when I get a person in with endometriosis, I just don't go straight to the area of pain. I try to figure out, have they had a virus of some sort that is either causing the endometriosis or mimicking the symptoms of endometriosis. So generally I will treat their whole immune system and the endometriosis goes away, because the body then can self-heal and self-regulate, because the immune system isn't overwhelmed with a hidden virus. I talk about viruses being the bane of most evil things that happen to the human body. It's because modern medicine doesn't either acknowledge them, test for them, or even know what they are, because there are thousands of viruses out there. Just take the coronavirus, for example. Nobody knew what that was a month ago. Now it's running rampant through China and potentially spreading through the world, and we're going to have another pandemic. So viruses are important. Also with endometriosis, it can cause some other random things. Like I had a run of 3 female clients that had knee pain. Now you would think, what's the knee got to do with the girly bits? So as it turned out, on palpation, their ovarian area was sorer than their knees by 1,000%. They had a history. One of them had a known history of endometriosis. I treated the ovaries, and I always treat the liver, and the knee pain went away. Why? It's because major lymphatic nodes are in the groin that drain waste and immune cells and all of that from those parts, also from the legs. So if that's all clogged up, the stuff in the legs has got nowhere to go, because lymphatic and immune system works with gravity and movement. So of course everything goes down. So the knees were painful, not because they had any ligament damage or anything like that. It's just because the lymph fluid couldn't get out of the legs, and there's lymph nodes behind the knees. And there's also a couple of major nerves that run past the ovaries down the length of the leg. So of course with endometriosis, those things can all get stuck together. So we try and treat the cause. So if you do have someone in your life or yourself suffers from endometriosis, please give me a call. Generally, Those patients have quite a significant detox, so you need to rest. You'll need a couple of days of not doing much intensive stuff after you've seen me in the clinic. But I can't give you any guarantees or anything like that. Legally, I'm not allowed to, but I know from experience with the clients that I have treated with endometriosis, and as any client that's had a viral infection, they get better. The body will heal itself once the viral load is decreased, and we can do that using these amazing medical devices behind me. So please give me a call. Don't suffer any longer. I look forward to seeing you, and once again, thanks for tuning into my frequency. See ya.